In this video, we'll be discussing the vertebrae. There are 3 different types, but first we'll go over the shared structures that are on all of them, and then we'll cover how to tell the difference. To start, we have the body of the vertebrae, which is this large structure here. We then have the pedicle that extends out of the body on both sides. The top portion of the pedicle is called the superior intervertebral notch. We're going to rotate it a little bit so we can get a better view. And this pointy area here is the superior articular process. And on the superior articular process, we have the superior articular facet, which is this flat surface here. You'll need to be careful to note if they are pointing to the flat surface or the whole upward structure. This large portion that points sideways is called the transverse process. This portion here is called the lamina, which is between the superior articular process and the spinous process. So this large pointy portion here is the spinous process. This is the part that you can feel when you bend over. Collectively, this circular portion is the vertebral arch. This vertebral arch helps make the vertebral foramen, which is the hole that the spinal cord travels through. Flipping the vertebrae over, we can see the inferior articular process, which is this whole protrusion here. And then the smooth surface would be the inferior articular facet. This portion here is called the inferior intervertebral notch. When we stack the vertebrae on top of each other, we can see the bodies will line up, and then we can see that the inferior articular facet will articulate with the superior articular facet of the following vertebrae. This space in between the vertebrae is called the intervertebral foramen. So like I said earlier, we have 3 types of vertebrae. To start, we'll be going over cervical vertebrae. These are in our neck and tend to be flatter and have 3 holes instead of just 1. These smaller side holes are called transverse foramen. You can see that this spinous process also looks a little different, how it splits into 2. So this is called a bifid spinous process. There are 2 cervical vertebrae that have their own names. The first one is called the atlas. It holds up the head and gets its name from the Titan Atlas that is responsible for holding up the heavens in the ancient myths. The second vertebrae is the axis. This is called the axis because it allows for the rotation of the head. This portion here is called the odontoid process. It can also be called the dens, which I prefer because it's easier to spell. You can see here that we stack vertebrae 1 and vertebrae 2 on top of each other to make the most upper portion of our neck. We then have our thoracic vertebrae, which is the one that we were looking at earlier today. These guys have a costal facet, which is here, which articulates with the ribs. These vertebrae kind of look like a giraffe, so that's how I remember that they are the thoracic vertebrae. We then have 5 lumbar vertebrae, which are shown here, and I remember these because they kind of look like a moose. They don't have any additional structures that you need to know. So to review, we have the cervical vertebrae, which will have 3 holes. Then we have the thoracic vertebrae, which look like a giraffe. And then we have the lumbar vertebrae, which look like a moose. So if we go to our full body, so here we have the whole body, and we can see the vertebrae stacked on top of each other. So we have 7 cervical vertebrae, then we have 12 thoracic vertebrae, then we have 5 lumbar vertebrae. A fun way to remember this is that we eat breakfast at 7, lunch at 12, and dinner at 5.